Have you ever wondered if the very medications meant to help you might actually be harming your brain? It sounds shocking, but new research is revealing a disturbing truth. Some of the most commonly prescribed drugs for seniors may be silently increasing the risk of rapid memory loss, confusion, and even full-blown dementia. These aren't obscure, rare medications either. They're household names, found in medicine cabinets all across the country. A landmark study from Harvard Medical School found that certain widely used drugs, especially those with strong anticholinergic properties, are directly linked to faster cognitive decline in older adults. Even worse, many people are taking more than one of these risky medications at the same time without even knowing the danger. Understanding medication-induced dementia is a crucial step in protecting your cognitive health. Many of us assume that medications prescribed by our healthcare providers are entirely safe. However, emerging research reveals that certain drugs, especially those with anticholinergic properties, may inadvertently impair brain function over time. This phenomenon, sometimes referred to as medication-induced dementia, occurs when a drug's interference with neurotransmitters leads to diminished memory, confusion, and cognitive decline. Scientific studies, including groundbreaking research from Hopkins Medicine, have demonstrated that prolonged use of certain medications may accelerate the onset of dementia symptoms. These medications can interfere with acetylcholine, a vital neurotransmitter responsible for learning and memory. In normal brain functioning, acetylcholine facilitates critical neural pathways that support our ability to process, store, and recall information. When these pathways are disrupted, cognitive functions begin to deteriorate gradually, often without immediate notice. It is important to note that not every individual taking these medications will develop dementia. Instead, certain seniors who may already be vulnerable due to age-related changes, existing health conditions, or genetic predispositions might experience a more rapid cognitive decline when exposed to these drugs. Moreover, the cumulative effect of taking multiple medications simultaneously, known as polypharmacy, can further increase the risk. Overlapping side effects may have a compounded effect that magnifies the potential for neural damage. Recent advances in neuroscience have further highlighted the complex relationships between pharmaceutical compounds and neural integrity. Researchers have observed that even drugs offering immediate relief can have long-term consequences for the brain when used over extended periods or in combination. This evolving field encourages both patients and healthcare providers to re-examine medication regimens and to prioritize routine cognitive assessments. Ultimately, medication-induced dementia is not a standalone condition, but a risk factor that interacts with an individual's overall health profile. By staying informed through reputable sources like Johns Hopkins Medicine, seniors can engage in proactive discussions with their providers to explore safer alternatives and strategies that protect cognitive function. Empowered decisions preserve mental sharpness and quality of life as we age. With monitoring and adjustments, patients and caregivers can minimize risks while maximizing benefits from medications. As we age, our bodies naturally become more sensitive to medications, and that sensitivity extends to the brain. Seniors over 60 are significantly more vulnerable to the cognitive side effects of certain drugs, and understanding why can help you take control of your health and avoid dangerous complications. One key factor is how our bodies process medications. According to research from the National Institute on Aging, age-related changes in liver and kidney function can slow the body's ability to break down and eliminate drugs. This means medications can stay in the system longer, leading to higher levels in the bloodstream and a greater chance of side effects, especially those that affect the brain. Another major issue is polypharmacy, which is the use of multiple medications at the same time. Many older adults take 5 or more prescriptions daily, often prescribed by different doctors for different conditions. While each medication may seem necessary, the combination can create unintended interactions that strain the brain and nervous system. It's not uncommon for seniors to experience confusion or memory lapses and never realize their medications might be to blame. Additionally, the brain itself changes with age. There's a natural decrease in certain neurotransmitters like acetylcholine, which plays a key role in memory and cognition. Drugs that further block or disrupt these chemicals, especially those with anticholinergic effects, can push the brain past a critical threshold, triggering symptoms of dementia more quickly. Lastly, many healthcare providers may not fully recognize the cognitive risks associated with long-term use of certain drugs in older adults. That's why institutions like the National Institute on Aging are working to raise awareness among both patients and medical professionals. By understanding these risk factors, seniors and caregivers can better advocate for safer prescriptions, regular medication reviews, and more personalized healthcare decisions that protect long-term brain health. Benzodiazepines are commonly prescribed to treat anxiety, panic disorders, and insomnia. They include well-known drugs like Xanax, alprazolam, Valium, diazepam, and Ativan, lorazepam. While effective for short-term use, studies have consistently shown that long-term use in seniors is linked to memory loss and an increased risk of dementia. According to a study published by Harvard Medical School, seniors who used benzodiazepines regularly had a 50% higher risk of developing Alzheimer's disease. These medications slow down the central nervous system, which can result in drowsiness, confusion, and problems with memory. In older adults, these effects are more pronounced and often misinterpreted as normal aging or early dementia. Many people become dependent on these drugs, sometimes unknowingly, because stopping them suddenly can cause withdrawal symptoms. If you're taking a benzodiazepine, it's important to speak with your doctor about tapering off safely or considering alternatives such as cognitive behavioral therapy, melatonin for sleep, or non-habit-forming anxiety treatments. Anticholinergics, e.g. Benadryl, diphenhydramine, scopolamine. Anticholinergics are a class of drugs that block the neurotransmitter acetylcholine, which is essential for memory and learning. These medications are found in many over-the-counter products like Benadryl, diphenhydramine, and are also used in prescriptions for motion sickness, bladder issues, and even depression. A study from the University of Washington found that seniors who used strong anticholinergic drugs daily for 3 years or more had a higher likelihood of developing dementia, even if they stopped taking the medication later. What's especially alarming is how common these drugs are in households and how casually they're taken for things like allergies or sleep. When the brain's cholinergic system is disrupted, memory and thinking skills decline rapidly. Seniors may notice brain fog, forgetfulness, and difficulty concentrating after consistent use. Safer alternatives include second-generation antihistamines like loratadine, claritine, which do not have the same cognitive effects. Always read labels carefully, especially on sleep aids or multi-symptom cold medications, as many contain hidden anticholinergics that can silently sabotage your cognitive health. Z drugs, e.g. zolpidem, Ambien, esopiclone, Lunesta. Z drugs like Ambien and Lunesta are marketed as sleep aids and are often seen as safer alternatives to benzodiazepines. However, research from the Cleveland Clinic indicates that these drugs also carry significant risks, especially for older adults. These medications work by altering brain chemistry to promote sleep, but they can also cause confusion, memory lapses, and even hallucinations in seniors. In fact, many seniors who take Z drugs report getting up at night without realizing it, driving or preparing food in a sleep-like state, activities that could be dangerous. Over time, regular use of Z drugs has been associated with increased risk of falls, nighttime wandering, and even dementia-like symptoms. The worst part? Many seniors take them nightly, unaware of the long-term cognitive toll they may be facing. Doctors from Yale School of Medicine recommend exploring non-drug solutions first, such as improved sleep hygiene, light therapy, or cognitive behavioral therapy for insomnia, CBTI, which has been proven to work just as well without the brain-altering side effects. Antidepressants, e.g. paroxetine, Paxil, amitriptyline. While antidepressants are essential for many people, some older types, especially tricyclic antidepressants and certain SSRIs like Paxil, have been linked to cognitive decline in seniors. These medications often have strong anticholinergic properties, which, as we've discussed, interfere with memory and cognition. A study conducted by Indiana University School of Medicine using brain scans and memory tests revealed that seniors who regularly took medications with anticholinergic effects had smaller brain volumes and lower metabolic activity in key memory regions of the brain. Paxil, paroxetine, a common SSRI, is particularly concerning for older adults. It's known to cause confusion, dizziness, and memory problems, even at normal doses. Amitriptyline, an older antidepressant also used for nerve pain and sleep, is similarly risky. If you're taking one of these medications, it's important not to stop suddenly. Instead, talk with your doctor about switching to newer antidepressants like sertraline, Zoloft, or escitalopram, Lexapro, which have fewer cognitive side effects. Bladder control medications, e.g. oxybutynin, tolterodine. Medications prescribed for overactive bladder or urinary incontinence are often anticholinergic in nature. Drugs like oxybutynin and tolterodine work by relaxing bladder muscles, but unfortunately they also block acetylcholine in the brain. A major study from University of California, San Francisco, UCSF, found that long-term use of bladder control medications significantly increase the risk of cognitive decline, especially in women over 65. Patients on these medications may begin to notice memory problems, difficulty concentrating, or increased confusion, often within a few months of regular use. Despite these risks, many seniors continue to use them daily without ever being warned. Safer options include bladder training exercises, pelvic floor therapy, and even newer drugs with fewer brain effects. It's worth revisiting your treatment. Plan with your doctor to reduce the risk of long-term memory damage. Antipsychotics, e.g. risperidone, quetiapine, haloperidol. Antipsychotics are sometimes prescribed off-label to manage behavioral symptoms in seniors with dementia, anxiety, or sleep disorders. However, these medications are known to carry serious risks, including worsening the very symptoms they're meant to control. According to the U.S. Food and Drug Administration, FDA, antipsychotic use in elderly patients with dementia is associated with a significantly increased risk of death. But even outside of dementia care, drugs like risperidone, Risperdal, and quetiapine, Seroquel, can cause confusion, sedation, and cognitive decline. These medications alter dopamine and serotonin levels in the brain, which can impair thinking, emotional regulation, and decision-making. Over time, regular use may lead to permanent memory loss or symptoms that mimic Parkinson's disease. Unless absolutely necessary, antipsychotics should be used with extreme caution in seniors. If behavioral symptoms are present, safer alternatives include environmental modifications, talk therapy, or non-drug approaches tailored to the individual. Statins, e.g., atorvastatin, simvastatin. Statins are prescribed to lower cholesterol and reduce the risk of heart attacks and strokes. While they are life-saving for many, there has been ongoing debate about their potential link to memory issues. Research from Mayo Clinic has shown that a small percentage of seniors may experience reversible memory loss or confusion while taking statins. The FDA even issued a safety communication noting reports of memory loss associated with statin use. Not everyone on statins will have these side effects, but it's important to monitor for sudden changes in memory, especially after a dosage increase. In some cases, switching to a different statin or adjusting the dose can help reduce symptoms. It's also crucial to balance the risks and benefits. High cholesterol also increases the risk of stroke, which can cause cognitive damage. The key is individualized care. Have a conversation with your doctor about whether your current statin is the best choice for your age and health profile. Proton pump inhibitors, e.g., omeprazole and Prilosec, esomeprazole, Nexium. Proton pump inhibitors, PPIs, are widely used for acid reflux, GERD, and stomach ulcers. They're so common, many people take them daily without a second thought, but recent studies have raised serious concerns about their long-term impact on brain health. A study published by Georgetown University Medical Center found that seniors who used PPIs regularly were at a 44% higher risk of developing dementia compared to non-users. These medications may reduce the body's ability to absorb vitamin B12 and magnesium, both critical for healthy brain function. Long-term PPI use has also been linked to changes in gut bacteria, which can influence inflammation and even brain health through the gut-brain connection. While occasional use is generally safe, daily use for years may silently impair cognitive function. If you've been on a PPI for an extended period, speak with your doctor about tapering down, switching to an H2 blocker, or managing reflux through diet and lifestyle changes. Opioids, e.g., oxycodone, hydrocodone, morphine. Opioids are powerful painkillers that are sometimes necessary after surgery or for severe chronic pain. However, they also have strong sedative effects that can impair thinking, decision-making, and memory, especially in older adults. Next, ask, does this medication affect memory or thinking? If the answer is yes, or even possibly, it's worth discussing alternatives or lower doses. Don't hesitate to follow up with, are there safer options for someone my age? And how long should I stay on this drug? Be sure to keep a medication list with you, including all over-the-counter supplements and sleep aids. Some medications interact with others in ways that aren't immediately obvious to even the most experienced physicians. You can also request a medication review, especially if you're seeing multiple specialists. A clinical pharmacist or geriatrician can evaluate all your prescriptions and identify combinations that may increase dementia risk. Finally, ask, can we schedule regular check-ins to review my medications? Medication needs change with time, and regular reviews ensure that what helped you last year won't hurt you today. These questions might seem small, but they can prevent serious side effects, preserve your memory, and even save your life. Sometimes, the most powerful lessons come from real people who've experienced these medication dangers firsthand. Across the country, countless seniors have faced unexplained memory loss, only to later discover that the culprit wasn't aging. It was what they were taking every day. Take the case of Linda, a 72-year-old retired teacher from Ohio. She began experiencing memory lapses, trouble focusing, and frequent confusion shortly after being prescribed a common sleep aid, Zolpidem, Ambien. Her family feared the worst, early dementia. But after a visit to a geriatric specialist at Johns Hopkins Medicine, they discovered the real problem was the medication itself. Within weeks of tapering off the drug, Linda's clarity returned, and so did her confidence. Then there's Robert, 68, from California. He'd been taking diphenhydramine, the active ingredient in Benadryl, almost nightly for allergies and sleep. Over time, his personality changed. He became forgetful, withdrawn, and depressed. His wife pushed for answers and got a referral to a cognitive health specialist affiliated with the University of California, San Francisco, UCSF. The diagnosis? Anticholinergic toxicity? Once Robert discontinued the medication under medical supervision, his symptoms improved significantly. And let's not forget Maria, 76, who had been on paroxetine, Paxil, for mild anxiety for nearly a decade. What started as occasional forgetfulness progressed to missing appointments and losing her way in her own neighborhood. Her daughter, a nurse, suspected something was wrong and requested a full medication review. The attending physician, trained in geriatric pharmacology at the Mayo Clinic, quickly flagged Paxil as a concern. They transitioned Maria to a safer alternative paired with mindfulness therapy. Within 2 months, her memory stabilized. These aren't rare or isolated incidents. They represent a growing issue that is finally being recognized by top institutions like the National Institute on Aging, which continues to fund research into how medications affect senior cognition. The takeaway? Always be vigilant. If you or a loved one experiences sudden cognitive changes, don't automatically blame aging. Medications, especially the ones we assume are harmless, can have profound effects on the aging brain. With the right information, the right support, and the right questions, recovery is not only possible, it's likely. If you're over 60 and taking any of the medications we discussed today, don't panic, but do take action. Talk to your doctor, ask the right questions, and stay informed. Your memory, clarity, and independence are worth protecting. If you found this video helpful, hit the like button, share it with someone you care about, and most importantly, subscribe to our channel for more senior-focused health tips every week. Together, we can take back control of our health, one smart decision at a time. Stay sharp, stay safe, and we'll see you in the next video.